The pandemic of COVID-19 is producing a new wave of masked superheroes. As we are all continuing to combat the spread of COVID-19, it is important to remain diligent with the most effective measures, including the practicing of physical distancing, cough etiquette, hand-washing etiquette, and surface disinfecting procedures. Secondary measures, such as the use of face coverings, can help to lower the transmission of the virus. We can all benefit from unmasking the main reasons why wearing a face covering can be helpful, what types are available, and how we should correctly use them. A face covering can be helpful because the primary route of transmission of COVID-19 is respiratory droplets. The mouth and nose are the body's most vulnerable points of entry. But there are some exceptions to wearing face coverings. Children below 2 years of age and individuals who experience suffocation when wearing these face coverings should find other options. For a person who could be infected with the virus and is in the asymptomatic or pre-symptomatic stages, wearing a face covering could prevent unintentional spread of the virus. This is why it is suggested that face covering, along with physical distancing, can help to slow the spread of the virus. But face covering choices are not considered to be equal. Typically, when we refer to a protective face covering, we are talking about a flat, pleated, or cup-shaped layered filtering material that spans across the lower part of the face, covering the nose and mouth. These face coverings can be tied or strapped across the back of the head and neck or looped around the ears, and some have an adjustable portion over the bridge of the nose. Available face coverings are commonly called masks. Masks can be broadly classified into uncertified and certified masks. Uncertified masks are masks that can be created at home, and the construction varies in material and number of layers. These are commonly referred to as cloth face coverings by the CDC. Certified masks are manufactured to industry standards that are usually specified by country. Two commonly known categories are multilayer masks, such as surgical masks, and filtering facepiece respirators, or FFRs, such as N95s. Each type of mask functions very differently. A cloth face covering or a surgical mask can help to control the virus transmission to others, and an FFR can help to prevent the virus transmission to the wearer. Depending on the environment in which they are to be used, the appropriate mask should be selected. The material of masks contains fibers which, structurally, can act as filters. Given that COVID-19 can be transmitted by respiratory droplets, wearing the appropriate mask can potentially reduce the transmission rate because of the filtering capabilities of the mask. The most common type of mask is a cloth face covering. These are readily available, typically used by the general public, and often homemade from a wide variety of materials. The functionality of cloth face coverings is highly dependent on the materials used. Cloth face coverings made from tight knits or thick materials can be more effective, but could also make it more difficult to breathe. Because of the variety of materials and other factors, such as the number of layers used and the choice to include filter media, such as carbon or a sponge material, cloth face coverings cannot be regulated to conform to any standard. Some of the safety practices when using cloth face coverings include: always store the cloth face coverings by hanging. Ensure that the inside of the cloth face coverings do not touch surfaces. And wash cloth face coverings in hot water above 60 degrees Celsius after each use. Cloth face coverings provide the least degree of protection to the wearer and prevent only a limited number of respiratory droplets from escaping into the environment. Because of this, cloth face coverings should not be used in medical settings or factory settings, or as a substitute for PPE. Another type of mask is the multilayer mask. A multilayer mask is typically made from a non-woven material, normally constructed in 3 or more layers. The innermost layer, worn closest to the skin, is an absorbent layer to lock in moisture that is emitted by the wearer. The middle layer is the filter layer that prevents the transmission of particulates in both directions. The outer layer is the barrier layer that blocks visible moisture droplets from penetrating the mask. Multi-layer masks have characteristics of high breathability, high filtration, and low fluid penetration, and are typically disposable or are considered single-use masks. Multi-layer masks are effective in preventing the wearer from contaminating the environment by trapping respiratory droplets. They are typically tested to conform to stringent standards. Some of the best practices for the wearing of multi-layer masks include: tighten the metal on the nose bridge to reduce the gaps. If the mask becomes damp, replace it with a new one. And do not reuse single-use masks. Finally, a filtering facepiece respirator, or FFR, is a type of mask that is the most efficient in protecting the wearer from airborne particles. The FFRs can provide a two-way safety if it does not have a valve. The FFRs with the valve protect the wearer but may not prevent the escape of respiratory droplets. During a crisis, FFRs are typically reserved for medical and healthcare personnel. However, some manufacturing and construction workers may be allowed to use FFRs at the discretion of their employer. FFRs are tested and certified by various regulatory authorities. In the United States, the most common type of FFR is the N95, certified by the National Institute of Occupational Health and Safety, or NIOSH. A filtration efficiency rating is assigned to the FFR based on its performance. For instance, a rating of 95% means that the mask will filter out 95% of particles in the air, or particulate matter, or PM. Masks are also available with higher numbers in filtration efficiency, such as 98% and 99%. Some of the precautionary measures to be taken when wearing FFRs are to check if the FFR has been approved by the appropriate regulatory agency of your country, that the FFR is not dirty or expired, and that the FFR fits snugly over the bridge of the nose and seals across all edges of the mask against the face. The FFR should not have gaps where air can pass through. When used in safety-critical applications, there is a spray test that is used to ensure the proper fit is achieved. Regardless of the type of mask used, some of the best practices to follow are: wash hands prior to handling the mask. Cover your mouth and nose with the mask. Do not touch the mask, particularly the front, while wearing or removing it. While removing the mask, remove it from behind. Discard single-use masks immediately in a closed bin. And never share your face covering with others. Remember, the mask is an additional layer of protection in limiting the spread of COVID-19 and should be used in conjunction with other preventative measures such as maintaining physical distance, using proper cough etiquette, washing hands often, and ensuring surfaces are regularly cleaned. It is critical that we each do our part to slow the spread of this virus. Stay safe and stay well.